the pediatric population, probably 70% are here because of food issues and food sensitivities, and the other 30% are here for obesity-related issues. These children are seeing a whole lot of people and specialists just to help hold it together health-wise, and then ultimately academically. Absenteeism, I mean, asthma, biggest cause for absenteeism. And I've seen a lot of my asthmatic kids definitely less reliance on their inhalers and everything else, and feeling much better with dietary changes. And never before had there been a correlation even suggested to the parents. There are many more people being diagnosed with multiple chemical sensitivities. And I think it's like you have all the, early childhood sensitizations, whatever triggers it, so you got cow's milk sensitivity, wheat sensitivity, corn or soy sensitivity, and then that may seem to go away, but then it's really just a shift in the immune system. So then they've got all these environmental allergies and hay fever and et cetera, and then piled onto that, you start having maybe some OCD tendencies or anxiety tendencies. But meanwhile, you've accumulated a lot of medications along the way to help mediate the symptoms from some of this other stuff that's going on. And, you wind up as an adult with maybe a lot of issues, panic disorders, OCD issues. And so cleanup, sort of unburdening the body, is tremendous. I mean, I do it with a lot of the adult patients as well. Dr. Doris Rapp wrote Toxic World, and it's pretty much points out, I mean, exactly what's happening here. I mean, we're getting more immunologically and neurologically challenged because of the toxic overload, the toxins in our food and in our environment. They've been analyzing now breast milk, the stool of, the first stool of newborn infants, and they're finding, thousands of chemicals and some pesticide residues of things that were banned 10 or 15 years ago. So this whole toxic overload, there's just more and more that our immune system is challenged with and faced with. There are more children on prescription medications than ever before. And unfortunately, the medications carry with them their own side effects. So they may be necessary at the time, but down the road, especially a lot of the steroid-based stuff, then we're going to look at impact on bones. And then we'll say, okay, so when they're 25 or 30, are we going to be looking at knee replacements potentially?